So thank you everyone for letting me speak here today. Please have patience with me if I talk too fast, or if I think my accent will be okay with this crowd. We have a lot of Canadians, but if you can't hear me, I'm guessing that Kate will wave to me or somebody will say something if I do speak too fast or if I get too quiet. So the presentation today is on something that is incredibly near and dear to my heart. I would call it, perhaps I'd call it my firstborn. It's the World Young Leaders in Dementia Network. Firstborn, I don't have any other kids, just let's clarify that. So what this is it's a generation of individuals who are under the age of 40, who are all coming together across disciplines and boundaries to collaborate on different projects in the dementia space. I see a chat function, but I can't quite see the chat box right now. So if there is something that needs to be brought to my attention, again, please just give me the heads up. So my email address is there. I'm not sure if anybody else has that, but please always feel free to contact me if you would like any of these slides, or if you have an idea for a project for the World Young Leaders in Dementia, or if you have an idea on some type of policy paper that's come out that's upset you, if there's something we can do to help support advocacy on an international level, that would be, of course, our privilege. But I'll explain a little bit more about what we do and what we have the capacity to do, just so you don't think that we're more powerful than we are. And whoever said the housekeeping joke, that Kate and housekeeping, that's very clever. I've never heard that before on any webinar. So housekeeping for me, as I said before, if I talk too fast or talk too quietly, please let me know. And there's quite a bit of time at the end for questions and conversation, because I also want to use this as a platform to learn from all of you about how perhaps I could help guide this network to deliver more impact, or help guide it, not of course guide it myself. Okay, so who I am to begin with. This is a trestle track from where I'm from. So I'm from a small village in Vancouver Island. There is trains that run from one village to another village. Of course, there's roads, but this is from a 5-minute walk from where I live. If anyone's been to Vancouver Island before, you'll know that there's a very, very large Indigenous population there. So some of my research many years ago looked at dementia in remote and isolated Indigenous populations. Some of my research looked at dementia in the community. I originally began researching dementia when I was 18 years old, and I was doing my undergrad honors thesis, and I wanted desperately to continue this work, but there was no professor in my local university, so I had to do a 2-hour ride to get a professor from a different university. That just tells you the state of where dementia research and advocacy has come in the last 10 years. So my research predominantly in the last, I'd say 7 years, has been in long-term care facilities. I look at the narrative of the nurse's aide or the care assistant in these communities, or in these homes, as some would call them. Care assistants are predominantly migrant women workers, and so I look at their experiences of how they deliver dementia care and how often they are not very supported. My mom she was a single mom of 4 kids, and so she worked as a care assistant in long-term care facilities. So as a young person, I spent quite a big amount of time in nursing homes. So I know that environment pretty well, so I think that might be one of the reasons that lately my research and my energies have been more focused on advocacy, which is what WYLD is. So WYLD is World Young Leaders in Dementia, but please, I'll try and not use acronyms as much as possible. Okay, so right now, that's a very blurred and pixelated image. Right now I'm in Dublin. So I moved from Vancouver Island to Vancouver to Montreal, did some work in Toronto, and now I'm in Dublin at Trinity College. I'm with the Global Brain Health Institute, and this is something that caught my eye after I received my PhD, because what it does is it brings individuals from all over the world, especially low and middle income countries, together that all have a focus on different aspects of brain health. So not necessarily dementia, but predominantly dementia. So right now I am in a cohort of 16 other individuals, literally from all over the world, who all focus on different aspects of how they can help their home nations' populations with brain health issues. So it's pretty cool. I guess to talk just for one more second about that, two individuals who I work with that are doing absolutely brilliant research. One of them is an Egyptian neurologist that looks at how to identify dementia in younger populations. And one of them is a brilliant Irish woman who looks at biomarkers for dementia in individuals who have Down syndrome. So another super, super interesting thing to research. So I have a number of brilliant mentors. I didn't ask anyone's permission to use any of these photos. And as you can see, I do like that white blouse I'm wearing a lot. So Kate has been a mentor since I met her in 2015. I don't know if she knows that. Al knows that, and Mary Beth know that as well. Mary Beth and I worked very closely on a research project looking at stigma in retirement communities. So one of the research things I looked at was some of them are quite high income retirement communities. So looking at how stigma was perceived in these settings. And then Al and I have been discussing various projects since I met him at Alzheimer's Disease International's conference in Budapest in 2016. So these are photos of individuals who help guide the work that I do. And basically I think about them if I'm going off track a little bit with my work. The other group that I'd really say would help me is the steering group for the World Young Leaders in Dementia. And I think, yeah, so this is a busy slide, but the steering group of individuals that I work with, they've really helped me for the last 4 years, help hone my ideas, my passion for the areas to focus in, and basically just where I should be diving my energy into deeper. So what WYLD is you can see our symbol in the corner there. So we're a network of passionate young professionals who are working across disciplines and borders to develop innovative dementia solutions. So this is from a postcard that we help design for different conferences that we go to. I'm going to explain in just a second about where we came from, but some of the things we do is we really try to foster a culture of collaboration. Doesn't matter what university you're from. We have a number of individuals who don't attend university at all, but they may be care partners to family members with dementia if their parents have early stages of dementia, or they may be individuals who are entrepreneurs and have a brilliant idea in the dementia space. So definitely not just university setting people. We also work very hardly to contribute to our local nation's dementia strategies. So I know some of these slides have a lot of information on them, but I have under 20 slides. So thank you for sticking with me on this. So right now we have over 300 members from over 30 countries on all 6 continents. All of them are individuals who are under the age of 40. How this started was in 2014, there was the Global Action Against Dementia Legacy events. And these were just huge conferences that all were rah, 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 let's do something about dementia. But this happened at the exact same time where I was starting my PhD. I had one of the first blogs about dementia in Western Canada, definitely one of the first ones by a millennial in Canada. And so I was incredibly excited to get involved in any way possible. Again, remember at that time, I was doing a PhD. I had a very hard time finding a professor to supervise me who focused on dementia. And I really was, I don't want to say desperate, but I was pretty desperate to find a cohort of buddies who were all focused on dementia-related issues. So I was invited to the Ottawa event in Canada in 2015 in the fall, and from that event, we then had a US event in Washington, DC, an event in Tokyo in Japan, and an event in London. And so the purpose of all these events was basically to discuss the global action against dementia for the G8 Dementia Summit. So here are some pictures of that. So this was the event that happened in 2014 in Tokyo. Interesting thing about this event is that it was, you can see predominantly males at this event, whereas every other Young Leader event was predominantly females. So this one, and we actually wrote a paper about it, comparing the conversations between the millennials in Japan and the millennials in the US and Canada. So absolutely brilliant conversations were coming out of both, but it was just, the differences were quite interesting. This is the London event. Of course, they have a much fancier building than any of the other ones. And this was me and a number of the members of the steering group at the World Health Organization's first ministerial conference on dementia. So that was in 2015 in Geneva. Kate also spoke there. I believe what she said is on YouTube. We presented to the World Dementia Council, but we didn't have an opportunity in the big room that Kate did. Maybe next time. Okay, so in the World Dementia Council, we have been working as volunteers or affiliate members in the World Dementia Council since 2016. The first meeting we participated in is in 2016. They used to have these groups called theme teams. We used to help with that in any way possible, but I believe they've now shut down. So now WYLD has developed a mentoring strategy to link up millennials or individuals under 40 with key leaders in the dementia space who are members of the World Dementia Council or somehow associated with it. So really trying to get that leadership from a global level to individuals who are maybe not so farther in their career. And we're using the World Dementia Council as a platform for that. So a lot of policy things that we're talking about. So some of the core activities that the World Young Leaders do is we really try to facilitate professional careers in dementia by promoting training, mentorship, as well as career opportunities for individuals in this field. Our members range from, again, we have a number of advocates who focus on that, a lot of researchers, quite a few clinicians, entrepreneurs, and again, care partners, people. We don't have anyone living with dementia who's a member yet, but perhaps someday, of course, if that will happen. We do our best to contribute to international scientific and policy efforts. If a paper comes out that we want to write, not a rebuttal for, but maybe an opinion piece, we'll write that and post it on our website and get it through with our social media platforms. We also do our best to raise awareness of dementia in young people. So in 2015, we went to the NCD Alliance, and we were one of, I think, 4 people in this conference, huge conference of a few hundred people who were talking about dementia. So we do our best to talk about dementia in a scientific manner wherever possible. On a local level, that's a lot of talking. This really is interesting, just talking to my computer screen, but I can see people. So thank you everyone for staying with me. On a local level, we do our best to plan and realize dementia inclusive initiatives. So I've been working on a dementia inclusive initiative in Qualicum Beach on Vancouver Island since, I think since 2014, 2015, definitely. I've partnered with an individual who is working on a dementia inclusive initiative in New Zealand, and that started in 2016. So from that, we're able to share our knowledge of what's happening in our dementia inclusive initiatives. One thing that well, actually I shouldn't be ageist as a younger generation, but as a generation that uses our phones, quite often, we use Slack, and of course we use WhatsApp, and we use different social media platforms to be able to communicate with each other, so that there's constantly a dialogue going with different areas of dementia, education, awareness, research, clinical issues that are going on, things that are happening in the news. So it's really been a terrific platform to share knowledge in that light. So on a global level, we do our best to support policy efforts across all fields of research, cure, and care. We do a lot of open and collaborative research. There's one of the individuals I work with quite closely is a professor from the US who works with myself, another individual from Tokyo, and another individual from London on different stigma research. So he was one of the first individuals to develop a stigma survey and standardize it with his lab to be able to publish on these issues coming forward. Of course, we look at new technologies. we look at different, what's happening in the technology space, what we like, what we don't like. Perhaps if there's a new technology that's coming to market and we don't quite think it's appropriate, then we'll discuss that within our platforms and see if there's something we should do about it on an advocacy level. And of course, we talk about improving the quality of care across countries. One of the things that we are currently working on is the Global Dementia Care Statement is coming out, and we're doing a social media campaign for that. So making a video of all of us in WYLD, not all of us, but quite a few of us, to talk about what we would like to see happen with that action plan. So one of the things we did, and Kate knows this, she was involved in it quite a little while ago, quite a few years ago, was a scoping review of global dementia inclusive symbols. At that time, individuals were still saying dementia-friendly symbols. But what we did was we did surveys with a number of countries to look at, would people like to have one dementia inclusive symbol that we could then use universally. We have a huge amount of feedback, but it's not surprising that individuals didn't want to have one universal symbol. A lot of countries and a lot of organizations have put in a great deal of money to their individual symbols. And so I don't think we'll be seeing a universally dementia inclusive symbol anytime soon. It would be interesting to hear your thoughts on that. Although this report is done, I would definitely be interested in hearing what could happen, and perhaps this project could be brought back to life. So this is a huge slide, and basically all it's meant to say is we're busy, we do things happen, and they're going to continue to happen. Just picking out a couple of things that we've done. One of the individuals in 2017 in our group from Luxembourg used our membership and our support to help get a doctoral training unit for PhD students, specifically focusing on dementia. We lobbied the UN draft indicator framework for the Sustainable Development Goals to ensure that they include individuals who are over the age of 65. We commented on the World Health Organization's Dementia Action Plan, which again, we're going to be campaigning for changes. We'd have the mentoring scheme with the World Dementia Council, and not as often as DAI has, but we have virtual webinars, one of which Al was on a year ago, and we'll continue to have those in the future. So these are some of our key members in our group. They are absolutely brilliant individuals that, like I said before, I would consider them my peer-to-peer mentors. Who can I pull out to talk about now? So there's Melissa Chan. She is an entrepreneur who, you can see her, she is from Singapore. Her father had dementia. She is quite young, I believe she's 26, 27. She started a nonprofit looking at raising awareness in young people and dementia in Singapore. We also have Claire Walton, who is the communication officer for the UK Alzheimer's Society. We have Heather Snyder, who is the communications officer for the US Alzheimer's Society. There's Mei Lin at the bottom there, who researches dementia in sub-Saharan Africa. Honestly, these individuals are just absolutely brilliant, and it's my pleasure to work with them. I have just a couple more slides, and then I'm going to wrap it up. So so some of the goals I have for WYLD in the coming years, and I have applied for funding for this. We'll see if I am successful or not. Rejection is part of the game. I'd like very much for WYLD to follow in the footsteps of DAI. I would like us to become a legal entity. Right now we are 6 to 8 individuals who meet every 2 weeks. 3 of the individuals right now are women who have very young children. 2 of them are babies. It is not uncommon for us to have steering group meetings, which are all over Zoom, where the women have their babies on their laps while they're taking minutes, while we're engaging in discussions about advocacy and social policy reform. So I'd really very much like to find a way to become a legal entity where I can help establish some sustainability in this group that's really run off the backs of volunteers who are passionate about this area. I'd like to find ways to support members in low and middle income countries, especially Nigeria and Kenya. I would be very interested in seeing what we could do further to support these individuals. with what's happening on the local level for them. I would like to engage with Middle East and North Africa. Sorry, North Africa, not Northern Africa, unless there is that place. I had a conversation with an individual yesterday, and we will be holding a workshop in Lebanon in October for WYLD, which is very exciting. So I'd like to continue these conversations further. In the future, I'd like WYLD to have individual chapters, but to be perfectly honest, it doesn't matter if it's under the WYLD name or if it's something else, as long as individuals under 40 are being brought to the table to have these global dementia discussions, and their fresh perspectives, ideas, and energies are heard. Because I believe that going to a lot of these international events, it's a lot of the same old, and it would be, and this is my completely biased opinion, and again, I'm a volunteer who has never made any money on this. I think everyone would benefit from having a few more innovative, maybe progressive thoughts thrown into the matter, definitely including individuals living with dementia. I'd also like to support WYLD members and DA members' engagement. So perhaps there's further ways that we can collaborate together. One of our members is having a virtual reality hackathon in the UK in a couple months. He'd like to look at how perhaps we can get some input from DAI members over Twitter, over social media polls. We're still looking into how that can happen, but I mean, the opportunities and the ideas are all there. It's just figuring out how to make them happen smoothly and with not limited energy, but definitely perhaps limited time, just because we're all trying to establish our careers alongside this.